I wanted to provide a little bit of an update regarding enforcement activities with the health unit, just because we've had some inquiries from members of the public, and I know that some of our neighboring health units have also provided some updates about their enforcement activities, specifically related to changing regulations under the Reopening Ontario Act. So as a reminder, and I think we've talked about it a couple of months ago, so it's been a bit of time since we last spoke about it. But all of the different partner agencies that are involved in the enforcement of the Reopening Ontario Act, so this includes public health inspectors that are employed by health units, bylaw officers, police officers, all working together in the field of enforcement for these regulations, are all following what's called a progressive approach to enforcement, which you've likely seen on other websites, this description of the 4 E's. So to engage, explain, educate, and then enforce. So at HKPR District Health Unit, we do have our team of public health inspectors that are helping to support enforcement of regulations at the for the Reopening Ontario Act. And we do have ongoing routine inspections that without COVID, this team engages in inspections for things like food premises or personal service settings. So as part of their routine inspections, they might also be including aspects of compliance with different COVID restrictions, a part of provincial legislation. Our most typical way that right now that we're being notified of concerns by public is through the complaint system. So we do have a call center where individuals, if they're concerned about a premise or business, are able to call the health unit. When we receive a complaint, we start with the 4 E's, and we engage with that premise. So if there's a complaint, every complaint we engage with the operator or the premise owner to discuss what the requirements are and what the current status is. If we're seeing more complaints related to that premise, then we will send out a public health inspector if it is one of the sites that public health inspects. If it's not, it might be referred to bylaw or another enforcement partner agency. During that inspection, our public health inspectors will go out and speak with the premise owner and operator, provide education, have a discussion, ensure that they understand what the requirements are, and then look to them to demonstrate how they are going to come into compliance with the regulations. Following that initial inspection, there is follow-up to see whether or not the premise or the establishment is starting to follow those regulations. And if they're not, the next steps would be to either have a warning or to have a ticket issued to that premise. So since July, we have had 7 premises or facilities that have been issued fines for different infractions under regulations of the Reopening Ontario Act, and we've had 11 fines issued. So there have been, since July, 9 tickets related to lack of compliance with face mask or face coverings, and 1 ticket related to failure to enforce the proof of vaccination requirements under the updated regulations of the Reopening Ontario Act. And there are a number of premises that we are continuing to engage with in that progressive enforcement, and will continue to follow up with to ensure that they come into compliance with those regulations. I'm sharing this broader description with you because I have heard that sometimes when the public doesn't see our public health inspectors in action, they wonder what we're doing, and they wonder what's happening with those premises that are sometimes publicly stating that they won't come into compliance with the regulations. And so I'm sharing this to help individuals understand what our process is and reassure individuals that we are following up. Our enforcement approach is consistent with all of our neighboring health units unit. And unfortunately, in some circumstances, we have had to issue tickets and will be continuing to do so in collaboration with our partner enforcement agencies.